Well, good evening, everybody. My name is Carly Shortino-Poulter, and I'm the director of the ARC Advocacy Network at the ARC of Indiana. And I want to welcome you tonight to our Ask the ARC webinar on fetal alcohol spectrum disorder. The reality is, fetal alcohol spectrum disorder, or FASD, encompasses quite a bit, and it is one of the most common developmental disabilities that most people have never heard of. And so tonight we are very, very fortunate to have Jaclyn Franks, the executive director of the Indiana Alliance on Prenatal Substance Exposure, come to talk to us about FASD. So Jackie is an Illinois native and received her Bachelor of Science in Health Science and her Master's in Public Health from Benedictine University in Lisle, Illinois. She's also a certified health education specialist and a certified prevention specialist. Currently, she's studying for her doctorate in public health and global health leadership. She's worked extensively in health education, promotion, and primary disease prevention for over a decade and has committed her career to much of her personal life to helping Hoosiers live their healthiest lives. Jackie serves on several local and statewide coalitions and collaboratives, including the Kosciuszko Cares Drug-Free Coalition, Fetal Infant Mortality Review Committees, and the Indiana Perinatal Quality Improvement Collaborative for the Indiana State Department of Health. So I do want to remind you that as we are going along tonight, we are recording tonight's session and we will be posting it to our YouTube channel. So as you are asking questions, just keep that in mind so that you're not sharing anything you don't want the whole world to see. We've also opened the chat so you can put your questions in there. We're going to wait to answer those questions until the end of tonight's session. But I'd like to welcome Jackie Franks and thank you so much for joining us tonight.
Thank you so much for having me. And this is actually my first time on the webinar side. Usually I'm used to seeing people. So if you guys are comfortable introducing yourself to me in the YouTube world, please put that in the chat so I can get a sense of who is here today. And thank you so much, Carly, for the wonderful introduction. I am going to share my screen here, hopefully. Carly, please let me know if it's showing the correct view that we practiced.
Nope, it's showing the notes view again.
Oh, why is it doing this? And I forgot to share the audio last time.
Still have the notes slide.
How about now?
Still have it on there.
What?
Mhm. The funny part is we did actually practice this
We
before
really
we
did.
came in
And
here.
I've switched it twice and it's not okay, now I don't know what's up. I apologize. Heather, hello.
There we go. You've got
Right?
it.
Okay.
It is.
I did everything the same that I did when we practiced, and it's so messed up. All right.
If tech doesn't screw up at some point, I don't know what I'm doing.
Like you think after I've done this before, I should know how to share my screen by now. So Carly's going to put a link in the chat for you guys. If you wouldn't mind taking a moment to sign in for me, our grant does require us to collect demographic information from individuals we train. Even if you say you prefer not to disclose, that's totally fine. But if you are watching with more than one person, please fill out that link for each individual that is attending. So that way I can get some numbers to report for our grant. So today we are talking about FASD in a nutshell, and I'll give some background information on FASD if you're not super familiar. I know some of you on the webinar today or listening to the recording may have some lived experience, so you may know some of the things I'm going to talk about, but hopefully you all learned something here today. So a little bit about Indiana Alliance. We are part of Mental Health America of Indiana. We are funded by DMHA under a prevention grant, and we're also an affiliate of FASD United. And there's our wonderful staff. There's 3 of us that do this work on a daily basis. So just some housekeeping things. I can't see, so do whatever you need to do to be comfortable. Please utilize the chat for your questions. And I can't take verbal questions, but I will make sure I address any questions at the end. I do have a post survey that Carly has already posted in the comments, and we will send you guys a little certificate of attendance within a few days after the training. It might actually not be till the end of next week because Maria will be in Washington, D.C., and she is our certificate sender. So I have a short video, and I hope you can hear it.
When you don't know what symptoms to look for, disorders can feel so distant and unlikely. It can be hard to connect the dots on our own. Even doctors miss the signs of this invisible disorder. Many people are never diagnosed. Step forward if you know someone who is diagnosed with ADHD or described as hyperactive, impulsive, forgetful, makes the same mistakes over and over, has extreme reactions, or is described as quick to respond. Someone with prenatal alcohol exposure may be closer than what you think. Learn more about fetal alcohol spectrum disorders today.
So our learning objectives today, we're going to talk all about FASD, associated conditions, symptoms, and risk factors, explain why alcohol is dangerous to a developing fetus, identify FASD prevention strategies, intervention strategies, and also some treatment options. So to define FASD, because I'm going to use the abbreviation throughout, so just so you guys get a visual of what the letters stand for, it's fetal alcohol spectrum disorders. So this is actually an umbrella term that describes the range of effects that can occur in an individual that has been prenatally exposed to alcohol. These effects may include physical, mental, behavioral, and/or learning disabilities with possible lifelong implications. So remember that phrase umbrella term, because we'll come back to that in a moment. So this chart shows you all the effects of different substances on a developing fetus. So I want you to take that marijuana column with a little grain of salt, because the study is a few years old and there has been significant research since this was published regarding prenatal marijuana exposure. So some of these may have changed, but there is not an updated version of this, this chart that I could find. So in the alcohol column specifically, because that's what we're talking about today, alcohol in a lot of the different categories of short-term effects or birth outcomes has a strong effect. So strong effect on fetal growth, strong effect on anomalies, and strong effect on neurobehavior. Long-term effects, it has a strong effect on growth, strong effect on behavior, strong effect on cognition, effect on language, and strong effect on achievement. And you can see, comparing the different substances, there is no other substances that has as many strong effects as alcohol. And so for that reason, alcohol is considered the leading cause of preventable birth and developmental defects. This slide shows the most sensitive times of a baby's development to defects throughout the 38 weeks of pregnancy. So this is not specific to any of the particular substances I had on the last slide. This is just looking at during the pregnancy, what parts of that child are developing when, okay? So you can see that top line, that blue one that goes all the way across the screen, that is the brain or spinal cord. So you can see that that is developing consistently throughout the entire gestation period, or the time that the individual is pregnant. And some of the other body parts listed on this slide kind of have windows of development. So the heart, arms and legs, eyes and ears, you guys can see those listed there. So the interesting thing about alcohol is while we do know it affects the brain, it can also affect some of these other body parts or body systems during development, depending on the quantity that's consumed, the frequency, and of course the timing. So if alcohol is consumed, let's say at week 20, we know the heart is already done developing. So there's not going to be an impact on the heart. Whereas the eyes may have an impact because of, development that's happening during that period of time. So the first condition under the umbrella is fetal alcohol syndrome. And so this is actually the most commonly known but least prevalent form of FASD in the United States. Drinking in the first trimester of pregnancy can cause phenotypes. We're going to have a picture of those in just a second on the next slide. But a phenotype is a physical characteristic. And an FAS diagnosis requires evidence of prenatal alcohol exposure, evidence of central nervous system abnormalities, so structural or functional brain damage, presence of the facial features or phenotypes. I have a picture of those I'll show you. And then growth deficits, pre or postnatal or both. And here are some of the facial features. Now, this is just very abbreviated for you guys to get an idea of what those facial features might look like. There are, entire fields of study that are related specifically to these facial features. And so measurement of these facial features is very precise. It's not that a doctor would just look at an individual or a child and be able to tell if they have FAS. There are very specific measurement requirements depending on age, gender, race, all of those things. So the first one is thin upper lip. The next one there is smooth philtrum. So on a child that didn't have FAS, there would likely be a ridge under each nostril. And you can see on this child, it's not present. And then short palpebral fissure length. They're measuring the eye from corner to corner. So interesting thing about facial features is they're actually set on day 19 to 21 of gestation. So there are a couple of concerns with that. And the first one being the individual probably doesn't know that they're pregnant by day 21. Most people don't find out they're pregnant until maybe 6 weeks, 4 weeks, if it's really early. And so day 21 is kind of right in that window of unsure of pregnancy status. So there may be alcohol consumption that's occurring before pregnancy status is known. The second concern I always bring up when we talk about this is, remember back to that FAS slide I just showed you, where we talked about FAS being the most commonly known but least prevalent. There are a lot of providers that maybe visually don't recognize any facial features and kind of write off all types of FASD as a diagnosis if those facial features aren't present. When in reality, most individuals with FASD do not have the facial features or don't have all of them that would be required for an FAS diagnosis. So the other FASDs that fall under the umbrella, partial fetal alcohol syndrome or PFAS. So that requires evidence of prenatal alcohol exposure and includes some, but not all, of the characteristics of FAS. Alcohol-related neurodevelopmental disorder, or ARND. This requires evidence of prenatal alcohol exposure and central nervous system abnormalities, complex patterns of cognitive or behavioral problems not consistent with the developmental level, and phenotypes and growth retardation are not required for diagnosis here. ARBD, or alcohol-related birth defects linked with prenatal alcohol exposure. This includes medical conditions that affect other areas of the body that we saw on that windows of vulnerability slide, like the heart, kidneys, and bone problems, difficulty seeing and hearing, or reduced immune function. So this condition is not usually seen on its own, but it's usually diagnosed in conjunction with another one of these FASDs. And then the last, there's a lot of letters today, so I don't know if I have any, hopefully this is the last of my abbreviations, but the last one here is neurobehavioral disorder associated with prenatal alcohol exposure, or NDPAE. So this is actually a psychiatric diagnosis that's in the DSM-5 that requires evidence of prenatal exposure to alcohol and central nervous system impairments in cognition, self-regulation, and adaptive functioning. So this diagnosis was designed to be used by mental health providers to help facilitate understanding and treatment, and of course, expand access to diagnosis for individuals with an FASD. So now that you guys know about all the FASDs, maybe you can put in the chat, what do all of these have in common, or just about all of them have in common? And these are diagnostic criteria that come from, I believe, American Academy of Pediatrics. I'll give you a second to think. Because it actually is a big problem, not just in Indiana, but across the country. So they all, I don't want to spoil the answer. Heather said behaviors, that's good. I realize you can't read my mind. That's not what I was thinking of. But they do. We'll talk more about that. They'll require evidence of prenatal alcohol exposure for diagnosis. And so there are a lot of problems with that. Mostly because we don't do a good job of documenting that. And there are a lot of issues that surround that. At Indiana Alliance, we've done trainings on this. We've done trainings on stigma. We've done trainings on screening, all kinds of different topics. But the reality is there's a lot of stigma and there's a lot of shame that surrounds this. And so the pregnant person may not always disclose that alcohol consumption. And in a lot of other cases, even if that alcohol consumption is disclosed, it may not be documented. So there are a lot of individuals or families that we have heard from where that documentation just doesn't exist. And it's very difficult for FAC to be diagnosed without some sort of evidence of prenatal alcohol exposure. So national prevalence. So we actually do not have any state level data regarding how many pregnant people report using alcohol during pregnancy. My colleague Amelia and I reached out to the state specifically looking for this. And hopefully we will get it in the next year sometime regarding, I think, 2023 data. But we don't have anything at state level that specifically will tell us the prevalence here in Indiana. So we have to look at some of the surrounding factors. But national prevalence is 1 in 7 pregnant people report using alcohol during pregnancy. And I know in that video, their shirt said 1 in 9. Actually, that statistic was updated shortly after we shot that video. So slightly more prevalent than it was previously. And then another study showed that 1 in 20 school-age children may have an FASD. Now, I don't have kids in school. I don't know what class sizes are now. I think they're a little bit larger than 20. But that would, on average, just to give you an idea, be about 1 child in a class, at least, depending on the size of that class. And so most of those are undiagnosed or misdiagnosed. We'll talk more about that in a little bit. So this is estimated. I want to give my disclaimer. This is estimated prevalence based on Jackie's math, which is not always the best type of math. But looking at how many births and those prevalence rates that I just shared, you all can see that using that 1 in 7, there would be about 11,421 potential pregnancies exposed to alcohol. Again, we don't know for sure. And using that 1 in 20, about 4,000 children born per year in the state with an FASD. I believe this is conservative estimates because, again, we don't have good data here in Indiana. To give you an idea about alcohol consumption, because that is the cause of FASD, among women 18 to 44, which is what we consider associated with childbearing age, 45.6% report consuming alcohol. So that's current alcohol use, and that would be within the previous 30 days prior to being surveyed. and 12.6% report binge drinking. So these numbers are significant. And the reason for that is, almost half the population is considered current alcohol users. That binge drinking is even a little bit more significant because we know that as the quantity of alcohol increases, the frequency increases, and depending on the timing, the risk for FASD increases for that pregnancy or that pregnant person. So binge drinking is defined as 4 or more drinks at a time or 8 drinks per week. And then the definition of a drink, because I know a lot of times when you go to the doctor, they might just ask, if they do ask, how many drinks do you have? They don't always define what that is. You've probably all been to some sort of restaurant where you can order a margarita in a glass that's the size of your head, right? And if we're counting that just as one drink, the math isn't mathing. So one drink is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. So those, large beverages that come in very big glasses would actually contain more than one drink, potentially 4 at a time. Interesting statistic about COVID that I want to share because this is really relevant as we're assessing community risk factors and some of the issues surrounding FASD in Indiana. So a study that looked at alcohol consumption from February 2020 to November 2020 showed that drinking that exceeded guidelines increased 54% for women, binge drinking increased 42% for women, and in women with children under the age of 5, drinking increased 323%. So looking at that from kind of a public health lens, that's concerning to me because women with children under the age of 5 are probably still within that childbearing age range. And with higher rates of drinking, we know comes an increased risk of prenatal alcohol exposure. Other risk factors that surround alcohol-exposed pregnancies. So again, we don't have specific Indiana data, but we do have data regarding some of these specific risk factors. And these are not all the risk factors. These are the ones that I kind of picked out as being most relevant to the conditions in our state. So risk factors are low levels of education and socioeconomic status, history of psychological distress or mental health diagnoses or substance use, lack of access to care. I live in the northern part of the state. I don't know where all of you are, but I'm up here in Stark County, and I live in a maternity care desert. And recently across the northern part of the state, we have had 4 different facilities close their labor and delivery departments at hospitals. And all 4 of those currently don't have any access to labor and delivery at those hospitals. So there are maternity care deserts, and I could talk about that for a whole hour. But I encourage you to look, if you're interested in learning more on this, looking at the March of Dimes. They did a really great report from 2023 about access to maternity care in Indiana. That's very significant because if it's difficult to get care, those early days of pregnancy are crucial for prevention, right? In that provider doing the appropriate screenings with that pregnant individual, providing a brief intervention, and education to that pregnant person as far as how to have the healthiest pregnancy possible. And then the last one I have on here is a culture accepting of heavy drinking. And when you think about a lot of the events, I guess, that happen in Indiana, whether that's sporting events, racing, other types of community festivals, there is probably alcohol involved in them, right? And we know there are significant pockets of our state where drinking levels are higher than other parts. And so in looking at what's going on in those communities, right, is it because it's considered a college town and there's more alcohol consumption among young people? Are there other cultural factors at play that are increasing drinking? But that kind of social acceptance of alcohol consumption means that more people are comfortable engaging in those behaviors. And we're not anti-alcohol at all. We just want to look at the risk factors in being able to address some of the issues that are surrounding the risk of an alcohol-exposed pregnancy. So the culture is a big one, and also the partner being a heavier frequent drinker and engaging in substance use. There's been a lot of research that's come out, I'd say in the past year and a half, specifically looking at dad's impact for a potential FASD diagnosis. And there was a study that actually found that if dad is a frequent drinker, that can actually modify the genetic makeup of his sperm, which can persist for months even after he stops drinking. So it was very interesting. There's a lot more research needed in that field to actually see and identify what impacts that could have on that developing baby. So general symptoms of FASD, Heather talked about behaviors in the chat, learning problems, and disconnect between actions and consequences. So thank you. And if you guys have specific examples or anything you want to share in the chat regarding some of these symptoms, you know, that would help us all kind of learn from each other. And these are just general symptoms. I want to kind of say that right out of the gate. One of the reasons why FASD is so difficult to diagnose, not because, well, in addition to kind of that documentation issue surrounding prenatal alcohol exposure, the other reason is because there's no one size fits all case of FASD. It's everybody's different, right? And in some conditions, you know, if you've ever taken a screening online, maybe for anxiety or depression, it might ask you 10 questions and then kind of, a screener's not going to diagnose you, but it'll give you a good idea like where your risk level is. There's really nothing like that exists for FASD because all of these symptoms are so complex and can be so variable among different individuals. So the list of symptoms is inconsistent development. So usually smaller in size than average in babies. That could be low birth weight in an older child, you know, not meeting those growth milestones where they would look on the growth chart. Learning difficulties, poor impulse control, deficiency in higher learning, poor capacity for abstract, problems with memory, sensory integration issues, auditory disorders, motor planning disorders, difficulty in self-regulation, ADHD, odd eating behaviors, and disconnect between actions and consequences. And yeah, Heather, thank you. So one of your kids graduated cum laude from high school, but struggles with managing their life. And it's very common to see stronger symptoms in certain categories, but not in others. Like I said, there's no one size fits all case. And so we'll talk through some more of these kind of as we go through the rest of the lesson today. Brenna struggles with memories and has brain farts a lot, money and time management struggles too. Thank you, Brenna. So misdiagnosis is also very common. So children who present with external behavioral issues are frequently overdiagnosed with ADHD or attention deficit hyperactivity disorder, conduct disorder, and oppositional defiant disorder. Now, I have not seen any research specific to this, but just my educated guess is that these conditions are easier to diagnose than FASD. And there's nothing that kind of, you know, triggers the provider to say, okay, if they're exhibiting these symptoms or if we've diagnosed them with conduct disorder, you know, let's go a step further and do an FASD evaluation. I wish there was some sort of like magical flag we could put into electronic medical record systems to make that happen, but that's not happening right now. And so a lot of kids are diagnosed with other conditions when, yes, they may have ADHD and FASD. but they may just have FASD and we've diagnosed it as ADHD. That can be common also. Misdiagnosis is also very common. And so this was looking at a study that reviewed 100 consecutive admissions to a large university medical school's child inpatient facility. They found 26% met the criteria for FAS, but had never received a relevant FASD diagnosis. Another review looked at 500 children 4 to 18 years old who were placed in foster care, who were referred for a behavioral assessment. 30% were given an FASD diagnosis after a full assessment was completed, and 80% of those children had not received a prior FASD diagnosis. So this is something that is very commonly missed among providers. Carly says autism also, thank you. So very commonly missed because it is difficult to diagnose. And just to give you an estimate, FASD is expensive. And so the CDC estimates the lifespan cost for one individual is $2 million. And CDC estimates the US spends $4 billion per year for FAS alone. And so a lot of that is in treatment costs, in assisting individuals to get into, medical care, diagnosis care, things like that. We don't see a lot of funding in FASD interventions. We don't see hardly any funding in FASD prevention. And so it is important, and you guys have probably seen the studies or heard about them before. For every dollar that's invested in preventative services, we can save like $7 in lifetime cost of care. And so it is so important to support individuals that already have FASD and making sure we're providing evidence-based programming and interventions to help people live their healthiest lives and be as successful as possible in managing their conditions. But also that prevention piece is huge because there are a lot of places where we can do better in the healthcare system, in social services, in kind of connecting all the dots like that video talked about at the beginning. Right now, we're not connecting the dots because we're working in silos. So I have big dreams. I have big dreams. Someone dropped an unlimited amount of money in my lap. There are a lot of things we could do. So there are a few populations, and these are not specific to Indiana. So I just want to give you that. So I linked the study down at the bottom of the slide there. So there are pockets of the population where FASD prevalence is greater. So this was actually, the study was a meta-analysis that looks at a lot of different research studies, and these were done globally. So this data isn't even specific to the United States. But what this study found, and this was not all of the findings, these were the populations that I picked out that were most relevant to Indiana. Children in care, so foster care, there's a higher prevalence of FASD. Also correctional populations, so within jails and prisons, special education populations, and then specialized clinical populations. So looking at what one of those previous slides referred to, like inpatient care facilities. So in these populations, we know there are more individuals with FASD. And I will tell you from experience in working with correctional populations, and last week we just had Brian Holloman, who's the captain at the Elkhart County Sheriff's Department, join us for a webinar. One of our trainings that we did spoke specifically on this issue and how prevalent it is. And I'll kind of say this, but I think you guys know the answer. Is an incarcerated setting going to be a helpful environment for an individual with FASD? And the answer is no. And they probably don't even know they have the condition, most likely. But going back to those symptoms, specifically talking about incarcerated populations, one of the symptoms was a disconnect between actions and consequences. And that could be one of the reasons why we see more individuals with FASD in the correctional system, because there's not always a connection between the two sides of the brain regarding if I do this action, then the consequence will be going to jail. Or if I don't go to court, the consequence will be a probation violation and I will go to jail. There's not always that connection in the brain. Also, there's been research on individuals with FASD not always learning from that type of punishment. And so the incarceration, right, is meant to be a punishment for committing a certain action. And individuals that have FASD may not be able to make those connections in their brain of, I did this wrong, so that's why I'm in jail. And that is very common as well. So takeaways from those special populations I just mentioned, the estimated prevalence according to this study in these subpopulations was 10 to 40 times higher compared to the prevalence estimate for the global general population. So that's very significant. And if you're joining this webinar or watching the recording and you work with one of those populations, I would love to connect and see how we can work together and better care for and support individuals that have FASD in those populations. So another thing I want to bring to everybody's attention are some of the secondary conditions. So I also linked the study here on this slide, but individuals that have FASD are at a higher risk of developing some of these secondary conditions. And those are the following. So increased risk of suicides. There was a 45-year study with a sample of 54 adolescents between 13 and 18 that did have an FASD, and 35.2% reported suicide ideation. And that's compared to an 18.8% national average. So that's almost double the national average. 13% had at least one serious suicide attempt in the past year, compared to an 8.9% national average. Also, increased risk of criminal justice system involvement. So the average age a child with FASD begins having trouble with the law is 12.8 years old. 60% of individuals with an FASD come in contact with law enforcement at some point, and 35% will be incarcerated at some point. And so again, going back to looking at the whole picture, right? Connecting all of these dots. How can the symptoms affect this? How can risk factors affect this? And the last one on there is increased risk of substance use. I don't know what happened to my last bullet, but the risk of substance use among individuals with FASD is about 2 times what the average population would be. So thinking about these things, and thinking about risk factors that go into an alcohol-exposed pregnancy, right? We also know that an individual that does have an FASD is more likely to have a child with an FASD. And that, again, goes back to those symptoms, disconnect between actions and consequences, impulsive behavior, right? Increased risk of substance use. And so we see a lot of times there's like a cycle almost of, individuals that might be in the criminal justice system and have children at home and have been, using substances for most of their life. And their children may have an FASD, they may have an FASD, and it may never be diagnosed in anyone because the proper services are never provided, because there was never, whether it be a healthcare provider, social service provider, a friend, a family member, a neighbor that said, hey, maybe you should look at this. There are a lot of, I was reading online, I was looking at the Indiana Alliance website, and there are a lot of symptoms that might fit, with this child. Someone just asking the question. And Brian in our training earlier this week shared that was how he started looking at that diagnosis for his son, was someone just kind of put it out there. Like, have you looked at this or have you read about this? And he realized a lot of the symptoms fit and was able to pursue an evaluation. So if you guys have questions, please put them in the chat. I want to make sure I have enough time to answer them. But we're going to talk a little bit about resources for prevention, intervention, and treatment. And this was a quote from one of the SAMHSA. It was actually a treatment improvement protocol that I was reading regarding FASD, but I really liked this quote that they had in there. So I added it on this slide, and it said, one act of AEP prevention, which is alcohol-exposed pregnancy, can positively impact the life of the mother and the life of the unborn child. One change in how services are provided can multiply that impact many times over. So we approach this issue from a lot of angles, right? We talk about preventing alcohol-exposed pregnancies. Another form of prevention is also getting services to individuals that have FASD as early as possible. Because going back to those secondary conditions, right? If individuals receive services, diagnosis, services as interventions early, they're much more likely to have better outcomes throughout their life. I had a healthcare provider, I was doing a lunch and learn for medical students, ask me, I was doing a training similar to this, ask me, what's the point of diagnosing FASD? Why not just diagnose autism or ADHD? And I really had to stop and take a step back and think about that for a minute. On one hand, I understand, because if a diagnosis gets the child services, that could be beneficial, right? But on the other hand, we hear from a lot of families and self-advocates that receiving that diagnosis was very important to them, because it kind of helps the person and the family and the caregivers understand fully the complexities of what the condition is. And it's not easy. There's not a one size fits all approach, right? It's kind of finding what works best for that child or adult that has FASD, and trial and error in a lot of things. But it is important to get the correct diagnosis. I'll stand by that. And that was the answer I gave at the time, and that's still the answer I'll stand by. If you're diagnosing cancer, right? Are you gonna, if it's lung cancer, are you gonna diagnose colon cancer? Probably not. It's important to diagnose the correct issue. So anyway, kind of got off track there, but prevention steps anyone can take, and this is forms of prevention throughout the lifespan, I guess. So educating that no amount of alcohol is safe during pregnancy. This kind of seems like something that's well known, and it's actually not. There are a lot of healthcare providers. We did a needs assessment at Indiana Alliance in 2022, and we found that there are, I think it was about 15% of healthcare providers actually tell their pregnant patients that it's okay to consume alcohol. And then another vast majority of providers, like in the 70s, I don't have the numbers right in front of me, it's about 70-something% did not address alcohol during pregnancy at all. And the smallest percentage of providers actually were providing the correct messaging, which is that no amount of alcohol is safe during pregnancy. So while most of us think, or that are knowledgeable about this field, that this might be common sense messaging, it's not. And there are significant percentage of providers that are telling pregnant patients it's okay to drink, or you can have a glass of wine. And that's not true. And that is contrary to best practices and CDC recommendations. So if a pregnant person is consuming alcohol, they may be a patient of one of those providers that told them it's okay. And so it's important now that you all have received this education, right, to educate or offer resources if a pregnant person is consuming alcohol or substances during pregnancy. We have a ton of information on our website. Educational information, links to community resources. Indiana has a really great program called Pregnancy Promise that now does include prenatal alcohol consumption. So that helps. And I believe there are some eligibility requirements for that program. But the patient would get kind of a nurse navigator to kind of walk through them through all the steps of pregnancy and helping them reduce their usage and ultimately help their pregnancy be as healthy as possible. Encouraging contraception usage among women of childbearing age who do consume alcohol. That is another strategy that the CDC recommends as effective in reducing alcohol-exposed pregnancies. So that way, if pregnancy is unintended, as about 48% of pregnancies in Indiana are, we're reducing that risk, like I talked about at the beginning, of prenatal alcohol exposure before the pregnancy status is known. And then the last one is identifying signs of FASD in youth and adults. Intervention is prevention. So when we're looking at those secondary conditions and other, I guess, negative health consequences that can result from an individual that has that can manifest themselves, I guess I should say, in an individual that has an FASD diagnosis, being able to assist them in getting that diagnosis and supportive services, both for the individual and the family, are very important. So I do have some resources I will share here. But treatment, like we talked about, there's no one size fits all magic treatment. There's no magic pill for FASD that'll cure it or treat it. It is an individualized approach that may involve a variety of things, including what I have listed there on the slide. So medical care, medication, behavior and education therapy, parent training, and then alternative approaches. So instead of spending all the time telling you what we don't have available, I will tell you what we do. And I will give a shout out to Heather, who's on the webinar here today. She's the director of the FASD United Family Navigator Program. And Heather is in Indiana, and she's the person I go to when I need information about stuff. So she knows a lot about FASD related resources. But we do have some resources on our website. I'll talk about the Brain Online. We have lots of educational information, and that goes from, I guess, preconception throughout the lifespan. So we try to have educational information there for everyone. We also offer trainings at least once a month that are linked on our website. And our coalition does host a family support group for families that are impacted by FASD. And then we also do have an Indiana FASD coalition, which helps to really look at the needs in different sectors across the state of Indiana. And we've divided the coalition into subcommittees so they can really focus on areas that the members are passionate about and want to work on making some progress towards. So if you are in need of specific resources or individual help, if you're looking for a provider, there aren't many, but we do have a list. You can contact us at Indiana Alliance or the Family Navigator Program, and we would be happy to help you. Anyone that's outside of Indiana, I always send them to Heather anyway. So you guys, if you're outside of the state, you can start there. Not that I don't want to hear from you. I just don't know everything Heather knows. Another program that we offer or that we can connect you with is the Families Moving Forward program. So that is the only evidence-based FASD intervention that is currently happening in Indiana. We have one therapist who is trained, and this program helps educate parents about behavioral support and ways to make modifications for their children. So this program is designed for parents of children that are 3 to 13 years old. So this isn't a program for the kids themselves, but for the parents. And there's been a lot of research showing that parent training is really effective in helping parents, I guess, modify expectations and looking at different accommodations that could be made depending on that individual child's symptoms and needs. And we do offer a screening tool on our website in alliancepsc.org, and it's called Brain Online. Now, this is not a perfect system, okay? It is not a brief screener where you're going to get an answer right away. That does not exist yet. Hopefully one day, but not right now. But this can be used by anyone. You do not have to live in Indiana to utilize this. It's totally free. So it will take about 30 to 45 minutes, I've heard, to go through the questions. And the survey results, or the screener results, will be sent to researchers at San Diego State University, and they review each set of responses individually, and then they provide a report. Now, the report is not going to be a diagnosis. The report may be very brief. It may say something like prenatal alcohol exposure is possible based on your responses. It's not going to be able to give a definitive answer without a clinical evaluation by a provider in person. But what this is good for is if a family is waiting for an appointment with a provider and there's a long wait time and they kind of want to take a first step, if someone is not sure and they're curious as to if FASD is even a possibility based on their symptoms, this is a good first step. And so this report can be shared with the health professionals when the individual or family does go to an appointment, and can be a step towards a diagnosis. So this is not meant to diagnose. It's probably not going to give you as much information as you really want to get from taking a screener, but it will give you some information, hopefully more than you had before you took it. It might take a couple of weeks for them to get back to you with the responses, but just so everybody knows, that is available on our website. So if you guys have any questions, please put those in the chat. I have our contact information on there. We would love it if you guys would follow us on social media. We would really appreciate that and the opportunity to connect online. We are on all the socials. I think there's a new one called Threads. I don't know. I'm not like up on the technology like all the Brenna would probably know. I'm not up on the technology like the kids are. But we should be on all of the socials at Indiana Alliance or in Alliance PSE, something along those lines. And if you have a couple of moments, and I think Carly's going to put that link in the chat for me again for our post-survey training, I would greatly appreciate you taking that survey for me. That helps us show impact from these educational programs, and also helps show our funders that we're doing what we told them we were going to do, which is educate. So I would really appreciate it if you took a couple minutes to fill that out.
Jackie, thank you so much for talking with us today. And I want to encourage people to go ahead and put their questions in the chat. I see somebody has their hand raised. We don't have the ability to unmute anybody. So if you could put your question in the chat, that would be really helpful. But I also want to point out to everybody, FASD is a developmental disability. So that opens up some other doors for them. So while they still have to go through the level of care screening process, they can potentially qualify for a family support waiver. Oftentimes people with FASD have multiple disabilities. And so, that opens up the doors for both the pre-employment transition services program, or pre-ETS, but especially vocational rehabilitation services, because sometimes individuals with FASD may have difficulty maintaining employment. And so VR can help with that. And so if they get a waiver, they can also have a waiver that can help with maintaining employment. There are a lot of different resources that are out there, but of course, getting that diagnosis is one of the biggest barriers, and especially because it does require that evidence of prenatal alcohol exposure, and that is what winds up delaying things a lot more. So we've got somebody on. How do I help my 18-year-old accept the diagnosis? She's been there for the doctor's appointments her whole life. How do we get her to accept it? And that's actually, I should let you talk, Jackie.
Yeah, that's a great question. I don't ever say I have all the answers, but I
think one of the things to stress in situations like this is just a difference in how the brain works. Having FASD does not make you a bad person. And unfortunately, that is not necessarily the message that they have gotten their whole lives,
Yeah.
because oftentimes these are people who've gotten in trouble all throughout school because of that impulse control issue, because of that impulsivity, because they don't necessarily understand the cause and effect. And so helping them understand, it just means your brain works differently. That's
Yeah.
all this means.
Yeah. And Heather, that's what I was going to suggest is I know we have a family support group. Heather actually co-hosts that family support group for us. But I would love to start an FASD adult support group for, individuals to just have a common space to come together and kind of share. I had the opportunity to go to Seattle for the international conference on FASD that's actually hosted by adult FASD self-advocates. And the environment there was so empowering and uplifting and positive. And I left just fired up, I'm ready to go. I'm solving all the problems in the whole world. I can do it now, right? I'm so inspired. And so hearing a lot of the similarities, in hearing them speak and in hearing them share was really powerful. And I know that's powerful for them too, because they get people to kind of connect with and talk about like, oh, you struggle with this, I do too, and I also struggle with this. And I think that kind of peer support is really powerful. And that's something I would do if I had an unlimited amount of money that someone just dropped in my lap. I see Megan's comment. Yeah, Megan, I think the research isn't available. Canada has a lot of great research. A lot of information that we get actually comes out of Canada. FASD in Canada is looked at a little bit differently than in the United States, and there's a lot more awareness and funding for support. I think more awareness through the community. I've had students or doctoral students, attend my trainings and say, this is, we had no idea that this was an issue. We're going to do some research on this, or we're going to work on this for our dissertation project or things like that. And so that's helpful. Also, I don't know if Heather posted any information to the Respect Act. We've been trying to get a piece of legislation passed at the federal level for years now, kind of as an FASD community. And if that legislation were to ever pass, that would help bring funding for a lot of the things that I mentioned, for the research, for the prevention, for the interventions and the treatments, and in helping support all of those different realms. So that would be very important. But as far as the actual state level data, it's been collected. It's just not available. So hopefully soon, if I ever get any state level data about alcohol exposure during pregnancy, I'll probably be thrilled, because it's a huge barrier in my job in educating. But I'm gonna tell you this is a problem, but I don't really have the data to support that this is a problem. So hopefully that will be available soon. I mean, you can, if you know anybody at the CDC, you can make them analyze it faster. That would help.
One of the things that I'm also thinking about is how to help individuals, after they've learned that they have FASD. And I tend to think about some of the more practical day-to-day type things. And so one of the things to recognize is we have a lot more technology now than there ever has been in the past. And so, for some individuals, it's going to be things like, downloading various apps to to help support their their daily needs. It's going to be teaching them those those processes, or those routines to help get them in that routine, because that helps reinforce how to do certain things. So when you think about it like that, because a big part of this is we've got to make sure that they're getting the supports they need to be able to live their lives and to live their lives how they want to live them. Then it's also, a lot of times individuals with FASD also have mental health needs. As you see my lights going on and off
Why
here.
is it getting so
Uh,
dark in there?
Ironically, our lights are all automatic, but that means if they don't detect movement, they go off. So every so often I have to like wave my arms. Um, but we also want to make sure that because there is such a high prevalence rate of mental illness that people with FASD experience, we saw that they have almost twice the suicidal ideation rate and about 50% increase in credible attempts. We want to make sure that they're also getting appropriate mental health treatment.
Yeah.
So make sure that you're working that you're trying to help your loved ones find a mental health provider who actually understands FASD or is willing to research FASD
Yeah.
so that they can provide the appropriate support too.
Yeah. And we hear from a lot of parents or caregivers or families that say, I've educated so many providers about FASD. And that's true. A lot of providers are not aware. And that's not necessarily a fault of theirs because they weren't taught it. It's not part of curriculums. And this condition, I would say, I have a whole training looking at the history of FASD throughout. I mean, we've known prenatal alcohols and exposure is a problem for thousands of years. I mean, there's documentation from 100 or 200 BCE that talks about the dangers of prenatal alcohol exposure, but it wasn't officially and formally identified in research until the 1970s. And the FDA didn't issue their first warning until the 1970s. So in terms of, history, this is relatively new. And so a lot of curriculums, for social workers and doctors and other healthcare professionals, it's not included. Or if it is, it's very brief. It might just be a slide. I did hear from a med student, yeah, we learned about that. It was one slide in all of their training, right? You had 30 slides from me today. So technically, I mean, you all have more education than a lot of the providers do. And so a lot of their providers are seeking out outside resources. They'll come to my trainings, they'll attend other similar trainings, they're reading the research. And it's a lot of that self-education they have to do. And so, yeah, it's important to, as if you're a family that's looking for providers, you might have to talk to them about it. Like, have you worked with this before? What do you know? Would you mind if I told you more about, my child's specific symptoms, so that we can assess whether this is a good fit? Because they're not all going to be. And so, yeah, that individual advocacy, I would say, is really important to helping create more awareness throughout the community.
Yeah. If you are someone who has a loved one with FASD or suspect you may have a loved one with FASD, one of the biggest things I want you to know is you're not alone. There, like we said, it is estimated to affect as many as 1 in 20 children. So there are lots of families affected by this. We get a decent number of calls here at the ARC from families who have a loved one affected with FASD, and whether that's because of our partnership with Indiana Alliance and FASD United, or if it's coincidental, I don't know. Because I will say we work with Jackie, we work with Heather at FASD United quite often, and I don't know which came first, whether it was the FASD calls and reaching out to them, or reaching out to or knowing them, and then because we cross refer all the time. So I want to thank you so much for joining us tonight. September is FASD Awareness Month, and so part of it is spreading that awareness and letting people know this is common, and there are ways to address this, and when people actually get the supports that they need, it makes a huge difference in people's lives. So So thank you all so much. And by all means, if you have questions, like I always say, if you're anything like me, you're going to think of something 3 weeks from now. Reach out to the Indiana Alliance on Prenatal Substance Exposure. Reach out to FASD United. Reach out to the ARC of Indiana. Talk with our family advocates. We are all glad to help. And like I said, we cross refer all the time. We talk to each other all the time. So you get all of us
Yeah.
in this. So
Yes. We're happy to help. Thank you so much for having me, Carly, and I appreciate everybody's engagement in the chat. I just realized not everyone could see everyone's comments, so I appreciate you all engaging in the chat, and it's good to talk with all of you tonight.
thank you, everybody. Have a wonderful evening. Bye-bye.